Hi, everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center and Stetson Chiropractic Clinic. This is number 83 live video, as a matter of fact. And as I mentioned before, we save each and every one of these, Fibromyalgia Wellness Center. Just go back and take a look at the many subjects that we've covered concerning fibromyalgia and related health subjects. And that's what we're going to be talking about today is missing the diagnosis, or again, we talked about proper diagnosis for patients, especially with fibromyalgia. But very, very interesting, on Thursdays, they have a new program on TV. I might be interested in it because it relates to fibromyalgia and also to other conditions. The name of the program is Chasing the Cure. Actually, what I think, after I've seen it a couple times, it should be called Chasing the Proper Diagnosis. These people actually call up, or they study and evaluate various people that have conditions that have not been diagnosed properly or not been diagnosed at all. And if that might sound familiar for those fibromyalgia patients that are still concerned whether or not they have fibromyalgia or have been misdiagnosed or diagnosed with fibromyalgia, very, very interesting. And I have to go back to 1990 when the American College of Rheumatology wrote the first paper on fibromyalgia, not only naming it but also discussing the many symptoms and where it actually started, came from, so forth and so on. It's important to understand that because when the paper came out, and this is quite a research paper by MDs and other various research specialists, the AMA, American Medical Association, actually frowned upon it and really questioned its authority as far as to recognize a new condition that really did not fit into the American Medical Association's way of diagnosis. As I mentioned before, the AMA, American Medical Association, with MDs, DOs, so forth, nurses, doctors, hospitals, diagnosed by way of objective tests. They send you out for all sorts of different tests, blood tests, urine, x-rays, MRI, CT, you name it, variety of different things. And when they get the results back, that's how they diagnose the condition. However, they ran into problems with fibromyalgia patients because these tests came back negative. Now, they were positive for secondary conditions like osteoarthritis, rheumatoid arthritis, MS, so forth and so on, that I've mentioned before, but not for fibromyalgia itself. And so that's why it's been so difficult to accept fibromyalgia as an actual condition. Well, lo and behold, that was in 1990. Now it's almost 2020, so we're talking 30 years. All right. After the AMA came down on that paper from American College of Rheumatology, one of the researchers, one of the head researchers, Dr. Eunice from the University of Illinois, wrote a rebuffing letter to the AMA, questioning their intelligence as far as an open-mindedness concerning conditions that possibly would be in the future, that if they held the same level of evaluation, the objective test, so to speak, that they would be missing a lot of new conditions that would come up in the future, and then when they would actually show up, they wouldn't know what to do with them. Lo and behold, guess what? 30 years later, maybe even sooner, that's what this program is about, chasing the cure. They've actually found that there's new conditions that are coming up they don't really have answers for. They don't really fit into any objective evaluation or the AMA's form of diagnosis. And so they actually have it on TV. It's very, very interesting. You're going to take a look at it. They have doctors that have their opinions, what suggests and so forth, because these conditions just don't fit into any real objective evaluative diagnosis, so to speak. So, and that's where we come all the way around with fibromyalgia from the 1990 study. Isn't that interesting now that they're actually doing this? What I always have suggested for fibromyalgia patients, or those people that really have concerns over proper diagnosis, you have to find a doctor that will sit down and ask you questions and listen to you, okay? Especially the history of your condition. When did it start? How did it start? How far can you go back? Was it a childhood? Was it because of some trauma or some social issue, so forth and so on? Look, if your doctor doesn't sit down and talk to you and evaluate you, because every patient that comes in, new patient, we sit down for at least 45 minutes to an hour just to do this and evaluate. Some people are right on. I know exactly when it started, after that auto accident, or after a death in the family, or after that illness, or I had molds and spores in a home, or one thing or another. They know about it, okay? They understand. But a lot of them are real insidious. They just kind of sneak up on you, you know? Now they're finding more and more aspects of conditions, again, like I say, that, again, are questionable. They just don't fit in. For fibromyalgia patients, it's the physical, emotional, chemical traumas. Again, physical can be auto accidents, traumas. Emotional can be death in a family, divorces, so forth. Chemical could be molds and spores in a home. Now they found that about 25% of all of the soldiers coming back from Iraq and Afghanistan, 25% of them not only have PTSD, but also they have fibromyalgia. So they're understanding that these physical, emotional, chemical traumas are actually triggering things in people. So you got to find a doctor to listen to you. That's very, very important. History is very, very important. Ask questions as far as when did it start. Diagnosis by elimination, so to speak, to find out exactly when your symptoms actually occur. I don't care if it's a rash or headaches or some unknown condition or whatever, or symptoms that haven't even been mentioned, so to speak. So for fibromyalgia patients, again, it really comes down to a couple real simple matters. Number one, find a doctor that'll talk to you. Number two, if you think you may have fibromyalgia, make sure you find out whether or not he believes whether or not fibromyalgia is an actual condition. I have people come in, patients come in and say, you know, he won't listen to me. He doesn't believe in fibromyalgia. Well, you're talking to the wrong doctor, okay? He's looking at all the other things instead of tunneling into what you actually have, okay? And so it's very, very important that you understand to pick the right doctor, ask proper questions. He has to believe in fibromyalgia. He has to be a little bit open-minded, okay, as far as your condition is concerned. You know, just because you come in, you got, you know, stiffness in the neck and so, it's not osteoarthritis all the time. Could be something else. You have to have at least 3 months of continued symptoms that move all over your body. You know, if you have a sore back, or achy back for a long period of time, that doesn't mean you have fibromyalgia. Okay, fibromyalgia moves all over your body. Okay, it just doesn't stay in one spot. All right, it's one of those things that, like, I call it the 365 flu. Okay, if you ever had a flu virus where you're just achy sore all over your body, that's fibromyalgia. That's very similar to fibromyalgia. That doesn't mean flu is fibromyalgia. So let's take a look at some of the areas and some of the most common symptoms for fibromyalgia. And again, I could be here until the 12th of never with all the different symptoms that patients come in with over the 30 plus years that I've worked with fibromyalgia patients. Let's just take a look at some of the most common ones, okay, and the areas that you should actually consider. The central nervous system, that's the first thing. The most common things for a central nervous system with fibromyalgia patients, fatigue is very, very important. Impaired memory, that's very, very important. Depression, suicidal thoughts, all those things. I've had patients come in, they're about ready to give up, and they say, you know, nobody wants to listen to me. You got to find somebody that'll actually do that. They'll actually sit down, you know, and that's one of the things patients will say, I can't believe, you know, you're giving me the time to actually open up and let you know how I feel and all the different things. I'm writing down notes and asking them questions as we go along. Musculoskeletal problems. That doesn't mean you have osteoarthritis, but keep in mind, fibromyalgia makes everything worse, okay? So if you ever have osteoarthritis, your joints are going to be achy, sore, and worse. But if you don't have osteoarthritis, it's still, musculoskeletal problems can still be very, very important. Achy, sore all over the body, not only the muscles, but also the joints. Again, that doesn't mean you have a joint disease. It just means that that's part of the fibromyalgia. Could possibly be fibromyalgia. IBS, irritable bowel. Very, very common, where you have stomach problems, you have gas, you have bloating, you have cramps, you have a combination sometimes of both constipation and diarrhea, as crazy as that might sound. and it just goes on and on as far as intestinal problems are concerned. Again, very, very common for patients. Genital urinary problems, where you have frequent urination or pungent urination, burning urination, spasms, abdominal spasms itself, or spasms in and around the bladder, intense PMS conditions, and also post menopausal PMS symptoms that actually kind of linger for patients. That's kind of interesting. Dermatological, you could have hives, you could have eczema, you could have rashes, you could have a variety of different things. You can have early hair loss, premature hair loss itself. It's called alopecia. Super sensitivity to touch on the skin. I would say a good 75% of the fibromyalgia patients have hypersensitivity to skin and touch, and so we have to be sure we treat these patients very, very gently as we go along, and that's probably one of the most sensitive things that we actually have to deal with. Also, there's a kind of a general area or miscellaneous area of symptoms where you have headaches, dizziness, dry mouth and eyes, which is sicca, which is again quite common. Ringing in the ears, again very common for fibromyalgia patients. Weight gain, and that's brought on by the fact that if you're feeling like you have flu, you're not going to go and exercise and feel better. And so consequently, exercise is usually something that is minimal for fibromyalgia patients. And keep in mind, as I mentioned before, if you're the same weight as you were this year than last year, you're saying, good, at least I'm not gaining any weight. But if you don't exercise, anywhere from 5 to 10% of your lean tissue turns into fat, adipose tissue, which then becomes, especially in and around your organs, which then becomes inflammatory, which actually adds to your problem. So keep that in mind. You want to stay as active as you can. I know that's going to be very difficult for fibromyalgia patients, especially because the way you feel. Do the best you can. Every little bit helps. But keep in mind, if you overdo it, you're probably going to be stiff, sore, achy, and worse maybe for a week or 10 days after trying to exercise. So you can't do certain things that you were able to do before. And the other thing is your immune system is compromised. So you're going to be more susceptible to other conditions just because of the fact that you have fibromyalgia itself. So again, chasing the cure should be actually chasing the diagnosis, get a proper diagnosis, and also possibly to reevaluate your secondary conditions. Reevaluate your secondary conditions because there may be additional ones that they have not even been categorized as far as the condition is concerned. So keep in mind, keep talking to your doctors and explaining to them all of the symptoms that you've had from the last time that you came into their clinic. Hopefully you've picked somebody out that'll listen to you. Hopefully you've picked out somebody that believes in fibromyalgia and is open-minded, and that will help you. We're always available, Stetson Chiropractic Clinic, Fibromyalgia Wellness Center, for anybody that has any questions or would like to look into our protocol and program that we've been using very, very successfully. We've got a lot of patients that have used our program. Go to our website, Fibromyalgia Wellness Center. Take a look at the videos in there with patients that we've had that have had a lot of successful treatment with our protocol. Anyway, next week, okay, Monday next week, we're going to be going back to talk about a subject that was in the news just over this past weekend. And it's very, very interesting. I spoke about this, let's see, I think it was May of 2018, and it was fluoroquinolone. Fluoroquinolone is a very, very dangerous drug. And I have to look at the name. It's under the names of Levaquin, Cipro, Proquin, Avalex, a variety of different ones. And this medication is literally a killer for many people. Matter of fact, it was on TV again. And problem is, see, the FDA you can't sue the FDA for allowing a drug to come on. It's almost like they have this specialty that even if they put a bad drug on and it kills some family members, you can't sue. Once a drug is on, it's almost impossible to take it off unless the company takes it off. You can black flag it, a variety of different things. And the warnings are on the medication itself, but they're lost in. Have you ever gotten any medications and you take that piece of paper out and you go, Jesus, or you can't even read it. There's so much stuff on it. Okay, well those warnings are in there, but it's not on the front something big that you can look at. So we're going to take a much closer look at fluoroquinolone and all the other names. Ciprol is probably the most common name that is being used in itself. And there's a lot of lawsuits and so forth on it. And it's being used by fibromyalgia patients, and it's not going to make you better. Oftentimes it will be haphazard to the point of possibly losing your life on this. That's how dangerous it is. And that's actually from a recent program that was on TV that I saw over this weekend. So anyway, take care. That's what we're going to cover next week. And see what's happened over the last year plus, so to speak, from when I spoke about this. And we'll throw a few more things in for you concerning fibromyalgia and other related subjects. This is Dr. Ken Muhich, Fibromyalgia Wellness Center. Just take a look at us on a website and take a look at what we have been doing. Also, this is number 83 live video. And so you can look back and check on many of the other subjects that we talked about concerning fibromyalgia. Blessing to all of you, and we're here to help you in case you need. Feel free to get in touch with us. Thank you so very much. Look forward to seeing you. Just take a look at the time. Perfect. We look forward to seeing you next week, 12:30 p.m. Arizona time, for another presentation, another live video. Don't be afraid to call in or check in. You can ask questions as we go along. Hope all is well to everyone. Look forward to seeing you next week. Bye-bye now.